Hello, 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 hello there. James William Mugeni is my name, a medical clinic officer by profession, a certified public manager. The Patient by Dr. Olive Kobusinje, Mulago National Referral Hospital Director. She's the author of this beautiful book. I'm going to read an extract from this book for you. My colleagues in uniform, the health workers. The health workers. I'm going to read for you just a small extract from this book. Uganda is one of the countries at the bottom line of the Human Capital Index, and she is failing to provide millions of children with basic things such as proper diet, education, and health care in their formative years. 29 out of 100 children are stunted and so at a risk of cognitive and physical limitation that can last a lifetime. As a result, a child born in Uganda, mark that, a child born in Uganda will only achieve 38% of his or her productive potential in life because of the limited investments, particularly in health and education, that a country makes in developing children. My colleagues, do you plead guilty? Do you plead guilty? Do you think that voter in Moroto knows what I have read? Do you think that voter in Tororo knows what I have read? Do you think that voter in Mbarara knows what I have read? What about a voter in Tororo where there is no blood in the hospital now? Did I read that well? Maybe I should reread it. I'm not so good at reading because I'm not a newscaster. It says, Uganda is one of the countries at the bottom of the Human Capital Index, HCI, and she is failing to provide millions of children with basic things such as a proper diet, education, and healthcare in their formative years. 29 out of 100 are stunted and so at risk of cognitive and physical limitation that can last a lifetime. As a result, a child born in Uganda will only achieve 38% of his or her productive potential in life because of the limited investments, particularly in health and education, that the country makes in developing children. And I asked Ugandan health workers, are you guilty? Do you plead guilty? I am not silent. That's why I'm speaking. I am not guilty. That's why I'm speaking. If anyone accused you, Ugandan health workers, this information, it is you who has it, and you want to hand it to a greedy politician. My appeal to you medics, the medics are attorneys. Medics are attorneys of the poor, but I stepped it, we are attorneys of the sick. Can we occupy our space and make use of the data? Those who have data or data which you don't have, because I'll have to make this video less than 5 minutes. Those who have data rule the world. Thank you for listening.